A very good afternoon, ladies and gentlemen. On behalf of the PCOS Society, India, and Philips India Limited, it is a pleasure to extend a warm welcome to all of you women today who are from various age groups and from very different walks of life, but with one thing in common, and that is an interest in the subject of PCOS. PCOS, short for polycystic ovarian syndrome, is a common condition affecting 1 in every 5 Indian women. It affects women of all age groups. The symptoms are delayed or irregular menstruation, acne, abnormal hair growth, male pattern hair loss, and sometimes difficulty in conceiving. As age advances, it also leads to various problems such as diabetes, insulin resistance, obesity, and cancers. Diagnosis of PCOS has been an enigma, and the treatment of PCOS is a huge challenge. It requires a multidisciplinary approach. Women health specialists, the hormone doctors, the nutrition specialists, exercise specialists, skin specialists, and mental health specialists need to come together to give the patient a holistic approach. In 2015, one dynamic gynecologist put together like-minded individuals and launched the PCOS Society India. In the last 8 years, it has grown to a membership of more than 1,500 members, and it has its swank offices headquartered in Kamla Mills Compound, Lower Parel, Mumbai. We have members who are specialists from all different disciplines. The society has been conducting conferences, seminars, webinars for training of doctors. But it does not stop there. We have many patient education programs across the country. We have a very active presence on social media, and our YouTube videos are very popular with a great fan following. The program today is only one another attempt to bring PCOS center stage and give our patients a chance to meet all the experts in one room. Today's program is made possible by Philips India Limited, whose purpose is to improve people's health through meaningful innovation. Today, we are going to have a multidisciplinary panel discussion to cover all aspects of PCOS. Then we shall have a panel discussion with all the stakeholders and policy makers. And after that, we have an open forum for you to interact on a one-to-one basis with the specialists. This will be followed by high tea and a very scrumptious, mouth-watering spread and some entertaining word search puzzle which has a very good educational value. But before that, I have a very pleasant task to do. I'm going to introduce a very strong-willed, determined, focused woman who single-handedly spearheaded the PCOS Society from its birth till to date. PCOS Society is almost becoming a teenager now. She works tirelessly, chases targets endlessly, and is committed to women's welfare selflessly. She is dynamic, she is energetic, her work style is systematic, and she delivers care which is holistic. She moves forward when all of us want to rest and always delivers the best. She has been the president of all top organizations of women's health in India and is now on board of various international organizations dedicated to women's health. She is recipient of the Distinguished Merit Award from FIGO, which is the International Organization for Gynecologists. Her efforts over the years have placed PCOS Society on world forums, and we have been invited to participate in policy making and developing guidelines which are laid down for the management of PCOS across the world. Her efforts have truly brought PCOS center stage. I have pleasure in presenting to you the founder president of PCOS Society, Dr. Durusha, and I invite her to deliver the presidential address. Madam, please.
Good evening, ladies and gentlemen. First of all, thank you very much for being here with us so that we could share our thoughts with you. I must compliment the presence here of our Deputy Director of Health Services, Mr. Chavan, Dr. Chavan. And of course, we have members from UNICEF, we have from ICMR, and we have various people here who are the stakeholders who are going to help us take PCOS further in this country. In 2015, I realized that PCOS did not have much of a role to play in any gynec forum. Most of the gynec conferences consisted of an hour of session of some amount of PCOS being discussed, and that's all. And there was so much confusion in the thoughts of both doctors and patients because there was so much difference in the definitions of PCOS. There was so much of a confusion that nobody knew what was going on. We knew there was PCOS, but there was not enough material or evidence on the subject. And hence we decided that we create an organization or one platform. Today everybody is talking about digital platforms. We created a physical platform of all stakeholders, all doctors who are interested in treating PCOS women. Now once we did that, and 8 years on, we have been pretty stabilized, following all the international standards. We thought it's high time for us to reach out to our patients because we know patients on an average doing studies that they have to have at least 3 consultations to 5 consultations before they know that they have PCOS. So in short, they are running from pillar to post. For their acne and hair growth, they are going to a dermatologist. Then for their obesity, they are seeing an endocrinologist. So they are going from place to place without knowing what's going on within them. And therefore, it was important to bring everyone together. And today, I must thank Philips India for offering us the CSR project, wherein they have put in a lot of money to ask the PCOS Society to do this awareness. And we are very, very happy to do this because this is something which is meant for women in this country. PCOS starts right from within the womb of the mother, and how we can prevent it, how in our country, because of the diabetes incidence, the prevalence of diabetes in our country is so high. If we can stop it at some spot, and we can stop the patients of PCOS being developed, who are the highest risk for having diabetes, I think we could have achieved a lot. And therefore today, besides talking to women at large, talking to them about the problem, we have with us the stakeholders whom I will introduce later. But before we go ahead, this Vijayata project, we have been doing all over the country. We have started 6 months ago. And this is our first project, first intervention wherein we are meeting patients directly, trying to understand what their problems are, making them aware of what's PCOS. And besides the 40 to 50 physical and digital sessions we have already done, we are still going to do many more. So look forward to the Vijayata program, which is going to be a big program, and it's already started. And we look forward to you all enjoying today's sessions. So I'll request Sangeeta to start off with the first panel discussion, and we'll go ahead with the experts who will talk to you all about the subject. Thank you very much for being here.
Thank you, madam. It's always a pleasure to listen to you, except when you're telling me to do more work. Friends, I'm sure even in those few little words that you heard from her, you will agree with me that she is so passionate about women's health and PCOS and bringing it center stage. Do you agree? Yes. Now we move on to this panel discussion, and it's my pleasure to invite our 2 moderators, Dr. Sandhya Saharan. She is the Honorary Secretary of PCOS Society, past President of Thana Obs and Gynae Society, and a consultant at the Hiranandani Hospital and Jupiter Hospital. She is a multifaceted personality with interests not only in women's health and PCOS, infertility and endoscopy, but in acting, singing, and farming. And her commitment to promoting yoga for lifestyle is truly commendable. The other moderator is a very dear friend, and Dr. Sarita Bhale Rao. She is a managing committee member of the PCOS Society. She has been the president of Mumbai Obs and Gynae Society. She is holding post in every conceivable society that India has. and is a consultant at the Breach Candy, Bhatia, Reliance, and Saifi Hospital. I now invite them to start the panel.
Thank you, Dr. Sangeeta, for the warm welcome. And it's my proud privilege to introduce our panelists first. I'll invite them to the dais, and then we'll start the panel discussion. First and foremost, who other than Madam Durusha? She has a very exhaustive CV, but it is so illustrious that I don't think I should miss a single word. She is the founder president of the PCOS Society of India, director of Gynac World, the Center for Women's Health and Fertility. She is panel gynecologist, Breach Candy Hospital, Jaslok Hospital, on the board of 3 international organizations on reproduction, author of approximately 200 publications and chapters in national and international journals and books, past president of 4 national organizations on women's health, first and only Indian to receive FIGO's Distinguished Merit Award, Mahatma Award 2021 for social responsibilities and gender equality, a very burning topic today, Lifetime Achievement Award for lifelong commitment to our specialty by Foxy, ISAR Lifetime Achievement Award for Excellence in the Field of Infertility, MOGS Dr. B.N. Purandare Outstanding Service Award for Lifelong Commitment to Healthcare, Midday Powerful Women 2022, for Iconic Gynecologist and Fertility Expert by the Governor of Maharashtra, Raj Bhavan, Mumbai. Yes, madam, we are all proud of you, and hopefully we do justice to the society which you have founded with so much passion.
Thank you. It gives me, is this on? Hello? I think it's not on. Gives me great pleasure to welcome our next panelist, and our next panelist is Dr. Uday Thanawala. Dr. Uday Thanawala is a leading practicing obstetrician and gynecologist from Navi Mumbai with over 40 years of experience. He's also very, very passionate when it comes to PCOS and gestational diabetes, and he has been an office bearer of many leading organizations, including the Navi Mumbai OBGY Society and the Federation of Obstetric Gynec Societies of India.
So now it's again the turn of our dynamic secretary, Dr. Pia Balani Thakkar, diplomat of American Board of Endocrinology, Diabetes and Metabolism, FACE, diplomat of the American Board of Internal Medicine, MD OBGY from KEM Mumbai, and FCPS and DGO, consulting physician and endocrinologist at Bombay Hospital and Breach Candy and Dr. Balani's Clinic, Colaba, Mumbai. She has various publications and papers to her credit. Her special awards are Best Doctors Mumbai 2022, Top Doctors Mumbai 2022 by India Today, Scope Certified for Obesity Management, America's Top Physicians by the Consumers Research and Council of America, Physicians Recognition Award with Commendation, Dastur and Purandare Prize, Purandare Memorial Prize, and Fields of Special Interest, Women's Health and Gynoendocrinology. Welcome, Dr. Pia. I think today the Mike and Sarita are going to have a face-off. So Sarita, you can share mine.
No, 2 minutes. Is it working now? Yeah. Okay. May I welcome Dr. Bindu Stalekar. Dr. Bindu Stalekar is a very well-known dermatologist practicing in Mumbai, Bandra, and also Goa. And as you can see, she has many, many achievements, and she has worked in the areas of Botox, fillers, lasers, and so many new hair regrowth treatments. Welcome, Dr. Stalekar.
Dr. Sapna Bangar. She is an MBBS and MD Psychiatry. And she is a Certificate of Completion of Training in Child and Adolescent Mental Health from UK, head of Empower, the Center, Mumbai. Areas of interest are adolescent and young adults' mental health, eating disorders, and family therapy. Welcome, Dr. Sapna.
May I welcome Dr. Twisha Parekh. And Dr. Twisha Parekh has a unique combination where she's a doctor and then has branched out into this new field of sports medicine. And she went on to do her master's in exercise and sports medicine in the UK, and she was working as a consultant sports physician at the Sir H.N. Reliance Hospital.
And we have Dr. Shilpa Joshi, Mrs. Shilpa Joshi. She is a consultant dietitian, Mumbai Diet and Health Center, Vice President, Indian Dietetic Association, Honorary Secretary, All India Association of Advancing Research in Obesity, Master Trainer, Obesity Conversion Maps, and Course Director, National Diabetes Educators Program. And she's trained more than 3,000 diabetic educators. She's won numerous awards, and she's awarded the Sri Award by Foxy in 2019. With that, I welcome all our esteemed panelists, but before we start the panel discussion, we have a pre-panel poll. So it will be flashed onto the screen, and you have to scan the QR code. I request you all to scan the QR code. That will enable you to participate in the poll.
Requesting everyone to please scan the QR code and enter your full name. Requesting everyone to please scan the QR code and enter your full name, and we shall begin the polls in the next 5 seconds.
If anybody has any difficulty, then do let us know. Okay, the doctors in the audience, they are requested not to scan QR code. I think it is for our participants other than the doctors. I think we'll start with the panel, and once they're ready, we can take the questions, maybe, the poll. Is that okay?
Yeah.
Yeah.
Good evening, everybody, and we'll begin with the panel. At the outset, let me thank Dr. Durusha and the PCO Society for giving us this opportunity to moderate this panel. My first question is to Madam Dr. Durusha. You are the founder of the PCO Society. What prompted you to start this organization?
I think I already mentioned it in my welcome speech that there was a need both by the physician to have a platform where everyone can work together, and of course for the patients to understand what is PCOS. So that was the agenda. And also to see to it that once we have given enough prominence to it and bring it to the notice of everyone that something like PCOS exists. The intention was to prevent long-term problems for women, which can be quite traumatic as you grow. And with simple situations, you can correct the problem and keep it under control. So that was the agenda.
Thank you, Madam. Come.
Dr. Uday, we are seeing a rise in PCOS cases. Could you explain the factors? Why are we seeing this insurgency?
Yeah, so PCOS was described way back in 1935, the whole triad of symptoms. Is it better? So PCOS was described way back in 1935 where they realized there's a correlation between certain symptoms like having extra androgenic effects like extra hair growth, pimples, obesity, irregular periods, and the structure of the ovaries when the ovaries appeared larger with multiple follicles. So that was what was PCOS described at that time. Gradually the knowledge has increased, the awareness has increased, and a big difference has been made now by the lifestyle changes which have happened over the years, where we have got a more sedentary lifestyle. People are exercising less, they are eating more of processed food. That has given a higher rise of obesity, and obesity is linked with PCOS. So we have a very high incidence of PCOS now. We are seeing it so much more frequent in young girls or in reproductive age group that you know it, and we all are aware. Even the patients are more aware about PCOS, and They go for a sonography to anybody, you get a report, the sonologist says, oh, the ovaries appear like PCOS. So whether they have or no is a different thing. But in general, people are tossing about this term PCOS, and now it's time we clear and tell the girl whether she has PCOS, she doesn't have, what needs to be done. And the incidence in Maharashtra is around 22% in the population. And so approximately in our practice, out of every 10 women we see, 2 of them at least would fall in the category of PCOS. It's important now to recognize which is PCOS and, of course, the treatment, where to reverse is again a very big role is played by the lifestyle changes.
Thank you, Dr. Uday. Dr. Pia, now you are a gynecologist who later trained in endocrinology. So I think you're the best person to explain in simple words what causes PCOS, because this is the most difficult and frustrating question that we get in practice.
Right, absolutely. So the cause behind PCOS is something that has been researched for decades. The current thought process is that this is a condition with a genetic background. That's why you find it passing from mothers to daughters. Sisters tend to have this together also. So with this genetic background, when you have an environmental trigger, let's say extreme stress, let's say a period of rapid weight gain. So for example, in puberty, when there's an interplay of a genetic background with a period of stress, it results in the body in a milieu of what we call insulin resistance. Very simply, what that means is that insulin is not working as efficiently as it should. The body's cells are not responding to the action of insulin. Now, due to this, what happens? A few effects. Number one, at the level of the ovary, the testosterone level goes up. Testosterone, like we know, is the male hormone. All of us females make a small amount of male hormone too. But when this male hormone level goes up, this manifests as acne, as excessive facial and body hair. And as a result of that, the patient will probably present in the clinic of Dr. Sthalikar, a dermatologist. At the same time, what happens with this excessive testosterone at the level of the ovary, with this hormonal insulin testosterone issue, at the level of the ovary, the monthly release of the egg is not happening. Now, what that results in is a menstrual irregularity. It results then in infertility as well. With that kind of issue, the patient will land up in the clinic of, let's say, Dr. Uday and Dr. Duru. Then, as a result of the insulin problem that is happening, glucose is not getting utilized efficiently. So what is happening to this glucose? The patient starts gaining weight. And with that obesity, as a result of which the patient will present maybe to a Dr. Shilpa, a nutritionist, or to a Dr. Twisha, who helps the patient with their exercise issues. And finally, when glucose is going up, this results in the long term in the higher chance of developing diabetes and lifestyle issues like hypertension, cardiovascular risk, and all of those hormonal kind of, let's say, the sequelae of all of that. And the patient might land up with me as an endocrinologist. And finally, to close that loop, all I'm going to say is that no matter where the patient lands up, one thing which each of us realizes is that with this group, there is a high level of anxiety, social anxiety, depression, and that is where one of the key players turns out to be the mental health professionals like Dr. Sapna. So finally, over here, what we have is a complex disorder with its manifestations, reproductive, derm, endocrine, gynac, and that's why you have such a big panel helping guide patients with one single condition like PCOS.
Absolutely. So it's quite complicated, and so many doctors are required to approach. So with that, yes, Dr. Uday.
Yeah. So it's a little complex to get to know to tell the patient that why is lifestyle change important, or why is her losing weight important, because she comes and tells us, I have come to you for infertility, I have come to you for my menstrual problem, why are you after my weight? Weight ke piche pad gaya tum. So I put them in a very, very simple form. I said, look, what she says is absolutely scientifically correct, but what I do and help my patients, I said, look, there is hormone secreted from your pituitary which go and work on your ovary. Ovary produces an egg every time, and that's how helps you to become pregnant or helps you to get your periods regularly. But in PCOS, what's happening is, because of a very complex mechanism, the hormones are diverted to your fat layer. They don't act in your ovary. The ovary has multiple eggs which haven't been released. That's why you call the term PCOS. This ovary then releases the male hormone and gives you all the problems of PCOS. So if you get rid of your fat layer or reduce your fat layer, your whole axis will come back to probably to normal, and it will help you. So that's when they realize, okay, weight loss is an important part of the treatment. So that's one trick which I do.
So I think that's a very important aspect. With that, I would like to ask Dr. Bindu, hirsutism and acne. These are the two most troublesome symptoms of PCOS. Can you explain your treatment approach in these patients?
Hello, can you hear me? Yeah. Now, when the patients are coming with hirsutism and acne, so when they have acne, like mild acne, then we can only just give them ordinary face washes, salicylic acid face washes, and maybe some exfoliation of their blackheads. That is when they have mild acne, so they only have blackheads. But if they have inflammatory acne is when they have pustules. In common lingo, we call it zits, red zits. If they have that, or if they have big nodules, and if generally they are hormone induced, then generally they get it in the lower jaw, in their lower part of the face or the lower jaw, and that is an indication that it could be hormone induced. And if a girl is coming to me with acne and she has associated hirsutism and maybe irregular periods and of course alopecia or thinning of the scalp, then of course I do investigate them and ask them to do their blood test and see if they have high levels of androgen or testosterone, as Dr. Pia Balani has said. Now, if they have mild acne, we can only just do away with salicylic acid face washes. But if they have inflammatory acne, and if the acne is grade 3 or grade 4, then they do need oral medications. Now, oral medications, and if associated with the zits, if they have also high levels of male hormones or androgens, they definitely need medication to bring those androgens down. So if those androgens are high, you will be sent to an endocrinologist. I know many of the girls say, "Doc, again you're sending me to another doctor." But this, I explain to them that if the male hormone is high and it needs to be brought down with anti-male hormone therapy, then only we can stop new ones from coming. The existing which are there, I can give you application of retinoids, even oral retinoids, but how do I prevent new ones from coming? So those new ones which have to be stopped by oral therapy, and accordingly, if the male hormones are high, you will be given, say, combined oral contraceptive pills, or even spironolactone can be given. These are the medications which can be given depending on what levels are high. Of course, there is one medication which we do give is isotretinoin, which just decreases the size of your oil glands, but that doesn't take care of the hormones. So you will be decided depending on what the levels are. Coming to hirsutism, again, hirsutism is only about 20% of people have idiopathic hirsutism, where PCOS may not be associated. But others do have high levels of male hormones. So if the high levels of male hormones are there, we do have treatment of hirsutism is laser hair removal. Gone are the days where we used to tell them to wax, to shave, and things like that. So laser hair removal, we do have sophisticated machines where it is painless and it is very quick. All these things are there, but remember, it takes at least 6 months to 9 months to a year to come to get some relief, number one. Number two, and again in hirsutism, if we find excessive hair growth which is there on the face, on the body, we have to do your levels to find out how high are your male hormones. If the male hormones are not brought down, you are not going to be having any success with your laser hair removal. All your money is down the drain. So please cooperate when your doctor tells you that let's do some hormone tests, because we have to bring it down systematically. It has to be A plus B plus C plus D. It's like diabetes. There's always a multi-pronged attack. Sorry, I'm using the word attack, but it is almost like that. So it has to be that the blood tests have to be done. If there is an associated increased male hormones, those male hormones have to be brought down to get any success even in your laser hair removal. The laser hair removal, the machines will target the existing hair. But if the androgens or the testosterone is high, they have to be brought down concomitantly. So if your male hormones are high, testosterone is high, you have to at least wait 2 to 3 months before you start laser hair removal. So these are the principles which we have to follow when I get people with hirsutism and acne.
Yeah, thank you, Dr. Bindu. I think the message is clear that we have to really take time, and treating PCOS is not a one-day thing and one visit. People think that, oh, dawai deke ho jayega. It's not really that. So just before we go on, we're now ready for the poll, and Sandhya warns me that if we don't do the poll now, it will be too late to do the poll. So let's have the poll. Can we have it right away? Yeah? Are we ready? Do they have to scan it again? They scan it again. So please scan again.
Please scan the QR code and enter your full name. Everyone's requested to please scan the QR code and enter your full name. And once everyone's ready, we'll begin with the polls.
So while they scan and enter name, one more question? No, otherwise the thing will go. Okay. So do we have time for one more question, or we're starting? Well, it says there is no poll currently opened. Okay, the question has come. Do you want to read it out?
Okay. All PCOS women are overweight or obese.
So they have to answer
yes or no. Five.
So we have the answer, well, not the answer, but the poll result, I'll call it. And in the first poll result, 78% of people have said no, and 22% have said yes. Do we need to comment on it? No. Do you want to comment on it? Okay. So let's go to the next one. And the next question is, are irregular periods a sign of PCOS? Yes or no? Yes or no?
Everything is yes or no. That's great. Complete century. Okay, the third one. Is darkening of the underarms, groin, and nape of the neck a clinical feature of PCOS? You've trimmed it.
Okay, so we have 81% who've said yes and 19% who've said no. Can we have the next question, please? That is question number 4. PCOS in women in their younger days disappears as they grow older, yes or no?
I know. So we are having people changing their mind. So should we lock this? 88% say no and 12% say yes. The last one. A woman with PCOS is at a higher risk of getting diabetes and high blood pressure. Yes or no?
Okay, and we have 92% who've said yes and 8% who've said no. So let's go ahead with this panel. And now we come to one of the most interesting areas, and that is diet. And I'm going to ask Dr. Shilpa Joshi, because whenever all of us think we are doing the right thing, we're eating the right thing, aren't we? हम तो कुछ नहीं खाते हैं, हम तो बराबर सब खाते हैं, but still diet is not quite okay. So Dr. Shilpa, can you tell us a few important tips on healthy diet for PCO?
So thank you. So healthy diet for PCO is 3 years of coursework, but let me put it in a nutshell. So like Dr. Pia said, the reason why this happens is insulin resistance. So the diet that you follow when one has PCOS, or rather even to prevent PCOS, is a diet which you would use for type 2 diabetes. So a diet which is complex, and in very, very simple terms, you need to eat less processed food. Dr. Thanawala also spoke about processed food while he was talking. And what do you mean by processed food? Anything that comes in packets. It doesn't matter what is in the packet. Anything which is pre-packaged is really not good if you're having PCOS. So the whole idea which has been floating now is from farm to fork. Eat natural, what is naturally grown in farms. You get it to your home and you minimally process it. Means you buy sabzi and you make a salad, bhaji. You buy dal and you make dal at home. Something to that effect, rather than making it into chivda or khakra or something which is extremely processed at that point. So it's very important to eat natural foods. Second thing is, Indian diets are inherently very low in protein. And because they are low in protein, they are very high in carbs, because you need to fill your stomach with something. And fat has been a bad word for now very long time. Last 30 years, we have been sort of demonizing fat. So we are eating a lot of carbohydrates, and that's the real problem. So when people go on diet, what do? They stop eating wheat and rice, and they start eating jawar and bajra and ragi. While they are not bad foods, we are celebrating International Year of Millets, but they have to be still eaten in very small quantity, because millets are food for farmers, and none of us are farming here, right? None of us are getting up and sort of going to farms in the morning and doing that kind of physical activity. An hour of gym does not give you a green ticket to eat what you like. It's nothing compared to actual farming. So one needs to be very careful. Very consciously one needs to eat proteins, and very good quality fats are very important. So while oil and ghee is understanding of fat, what fat really are good for PCOS is those coming from nuts and seeds. And again, there is a misconception that if you eat nuts, your LDL cholesterol will go up and your total cholesterol will go up. That's not how it is. So try to include nuts and seeds. Seeds are very, very important because they're lower in calories as compared to nuts. So you have so many seeds: sesame, sunflower, flax, chia. There are so many of them in market. Try to use them. And basically, just last one point, eat only if you're hungry. Don't eat because my maid comes at 12, I need to give her dishes, and my mom has packed food, so I need to have the dabba empty. Don't eat that, because you need to eat in response of hunger and not in response of boredom. Most of our people are eating in response that there is a dabba packed. If I take it home just like that, my mother is going to yell at me. So it's better that I eat it, right? So or my colleague is eating, so I need to eat because she's eating, so company dena padta hai, kind of thing. So try not to eat in response to other cues than hunger. Automatically your caloric intake will go down, and moment your caloric intake goes down, insulin resistance starts improving. Thank you.
That was very, very nicely put. And I'll go on to our sports medicine specialist, Dr. Trisha. So we all know the emphasis of sports. So what are your take on the fitness goals? How do you think people should go about their fitness?
So I think the goal should just be from wherever you are, keep aiming to get fitter, irrespective of the age that you are. So the aim should just be to keep getting fitter. There's really no upper limit to the fitness. Like everybody's mentioned, that insulin resistance is the biggest problem. So what exercise does it is that whatever exercise you do, the moment you start doing physical activity, exercise works to increase the insulin sensitivity of the cells, which means now the glucose in the blood actually moves from the blood into the cells. So your glucose level drops in the blood. So that is like a game changer. What a medicine can do, the exercise can actually do that. Of course, there's a different type of exercise. Depending on the type of exercise, some may move immediately, some may move at a later point. But whole on whole, if you just get moving, that is good enough from wherever you are. So what is the lower limit kind of a thing? No, we sometimes even have athletes, top level athletes who unfortunately do have PCOS. Why I would say that could happen is because they are actually very high in their carbohydrate intake. So sometimes even they do end up having PCOS. But again, our goal for them is, if you put in a little bit more activity, you will still become better. Your control will still be better than what it is. And as far as fitness goals are concerned, I will just take one thing. I just got one thing from what Ms. Shilpa ma'am just mentioned is company dene ke liye jana padta hai. I think the goal should be that if somebody else in my colleague is going for a run, he's going for something in the morning, or a lot of corporates are now having gyms within their offices. So why don't we give them company for that workout, for a Zumba class, for a yoga class, rather than giving them company for this? So the goal should always be, rather than making dinners with parties, let's have dinners with, having a little bit of physical activity thrown in, even if it's a game. So that way we can make it fun, interesting. We have some dash, and then you've earned that cookie that you're going to have later. And what happens once you're physically active, there is a sense of little bit of although you want to reward yourself, there is also like, I don't want to overeat and now undo everything that I have done. So once you get into this lifestyle habit, what we see again in clinical practice really is that people just become conscious like, Arey, I've gone for a run, now I don't want to simply overdo the eating part. So that's a good balance which just comes in. So I would say that should be the baseline.
I agree. Absolutely, Dr. Trisha. I think the most important thing is they should enjoy their exercise, and group exercise has tremendous benefits. It really secretes endorphins, and I think it goes a long way. So let's go to Dr. Sapna now, and this is one of the most sort of gray areas in PCOS, and that is mental health. So can you throw some light about how important mental health is?
See, there's no health without mental health is the motto generally. We've heard about from all the esteemed panelists what a complex and multifaceted disorder PCOS is. Plus, it really impacts the core of what we culturally hold ourselves as women. We have teenage girls, we have young girls with obesity, we have hirsutism, we have acne, plus the fear of maybe never becoming a mom. So it's like, the self-esteem is a problem here. I see a lot of children, and there's enough and more research to say that they go in hand with, there is a 3 times higher likelihood of clients having anxiety, social anxiety, depression, self-esteem issues, adjustment problems, body dysmorphic disorder, which is a huge thing because, how much ever they try, and they're trying really hard, when they look at themselves in the mirror, they do not like what they see. So there's body dysmorphic, there's eating disorders, and in rare cases, In rare cases, we also have psychosis and bipolar, but in rare cases. But otherwise, a lot of it goes in hand with the PCOS.
So let's go to the next round.
Yes. So we start with the next round with Madam again, Dr. Shah. Madam, you've been a pioneer in infertility and IVF. So now we are seeing a lot of infertility. It's on the rise, of course. And how would you explain the association of PCOS with ovulatory disorders and infertility? And how would you advise these couples or patients who come to you?
So when you have PCOS, irregular periods is one of the very common symptoms of PCOS. And why you have irregular periods is because you're not ovulating every month. Means you're not releasing an egg every month. You may be releasing an egg every 2 to 3 months. So in short, your chances of getting pregnant is only when you ovulate. So a woman can get pregnant only when she ovulates. That is at least for about 2 or 3 days in the month when it happens. Just once. You need just one egg to become pregnant, whilst a man needs millions of sperms to make a woman pregnant. Remember that always the woman is stronger. Number one. Second thing is that a woman, if she's ovulating every 3 months, her chance of getting pregnant is only once in 3 months. Whilst if she releases an egg every month, which she normally does, then she has 12 chances in a month to get pregnant. So that's the first thing. When she has irregular periods, she has difficulty getting pregnant faster. Not that she can't get pregnant, but it can happen faster if she would ovulate every month. Now, along with this irregular periods are all the hormonal changes we talked about, where there's increased male hormone, there is increased insulin in the body, there's increased obesity. All these factors affect pregnancy. So in short, there are various medications we can help patients with. Of course, lifestyle becomes the first thing we do. Even if a woman, which 80% of our PCOS women are overweight, we always tell them, try and lose weight, because even if you lose 5% to 10% of your weight, whatever your weight may be, you may be 100 kilos, but even if you lose 10 kilos, it'll be easier to get pregnant. So in short, we tell them, we give them small goals to start with so that they get encouraged. And we say, lose about 2.5 kilos a month, you're done. So that's what we do. Weight loss, of course, is through exercise, which is known, and of course through healthy diet, which has been discussed. The next question is that if a woman is lean, we have 20% of our patients who are lean, and they are the worst of the lot because they go undiagnosed. Nobody knows they've got PCOS, and therefore they get undiagnosed, but even they need exercise. They need exercise in terms of resistance exercises, weight-bearing exercises, muscle strength exercises. Those are the exercises they need, while the obese women require weight loss, means cardio. In short, weight, reducing the fat. So what we have to do is in fertility patients, we have to make them undergo lifestyle changes, number one. Give them medication so that they can release an egg every month, and then plan their treatment according to the problems which she may be having. If she's a young woman, it's very easy to get her pregnant with just getting her egg released. Of course, the male factor has to be, there are many other factors we have to look into, but where PCOS is concerned, these are the main things, and it's very easy to treat PCOS patients. So, unfortunately, many women think that if I've got PCOS, I can't get pregnant, which is wrong information. It's very easy to treat PCOS patients. So, I think fertility and PCOS, I think I'm happy to get all the PCO patients to treat. We get the best results.
Thank you, madam. Dr. Uday, my question to you is, what is this intergenerational transfer of PCOS? Can it be transferred from generation to generation?
Okay, before I come to that, I'll just take with what Madam said. It's very easy to treat PCOS with lifestyle changes and all. And it dawned on me when one of my patients just came and she says, I'm a patient of PCOS and I don't believe this. My urine test has come positive. I'm pregnant and I've been just trying for 3 months. And I said, yeah, but you must be doing the right things. Yeah, I was doing exercise. I've lost weight. I'm taking care of the diet. But I was told PCOS women find it very difficult to get pregnant. How can I get pregnant? So just lifestyle changes brought about that change, and she was pregnant. She herself could not believe it. but ultimately she's carrying on very well. So that's the importance of lifestyle changes. And when you talk about intergenerational the transmission of PCOS, sometimes one of the theories, what even Pia said, was that it could be something which is programmed in utero. Today we talk about even diabetes being programmed in utero if the fetus is subjected to a high glucose load. Similarly, if PCOS woman becomes pregnant, there is a possibility that the PCOS could be obese women, etc. They could be passing it on to the fetus.
So we can't always say it's all in the genes, but yes, sometimes it can be. So with that, we go on. Dr. Pia, you've just explained a little bit about hyperinsulinemia, and there is something called the metabolic syndrome. So how do you watch out for these comorbidities and the sequelae of PCOS?
Right. So PCOS is a condition, though the symptoms come in the teens, in the 20s, etc. This is a condition which goes on well beyond menopause. It's in fact lifelong. That's why basically with PCOS, one has to, where a patient might come with excess hair growth, with acne, with excess weight, with period irregularities, infertility, etc. These are actually red flags. They are warning signs of the future comorbidities that are associated with PCOS. They are windows of opportunity telling us that this patient is at future risk, and this therefore becomes a time where we start counseling the patient such that those future problems don't raise their head. What future problems are we talking about here? Girls with PCOS have a 3 to 5 times higher risk of developing diabetes, gestational diabetes for that matter also as well, high blood pressure, high cholesterol, and increased cardiovascular risk, sleep apnea, uterine cancer, and finally depression as well. As a result of which, what do we advise our patients in terms of monitoring? Well, of course, monitor your weight. Diet and exercise is the key. Remember, normal BMI for us Asian women is less than 23, not the 25 cutoff, which is for our Western counterparts. I'm not saying that our PCOS women have to reach that target, but it's important for all of us to know whether we fall in the overweight or the obese category in the first place. So monitor weight. Number 2, waist circumference. What's a normal waist circumference? Less than 80 centimeters or 31.5 inches. Why again this is important to know? This is a marker of truncal obesity, that unhealthy metabolic fat, which is what is classic of PCOS again. Stop smoking. If there's one bit of advice I talk to my girls about at every point of time, this is the biggest favor you can do to yourself. Number 4, basically monitor your blood pressure. At least once annually is a good idea to do as well. Number 5, check your cholesterol. Every 1 to 3 years is what is recommended. Number 6, check your glucose levels once at diagnosis and then every 1 to 3 years following that as well. Number 7, ask your partner, ask your mother whether you're snoring at night. This could be a sign of sleep apnea, again something which is highly correctable as well. Number 8, if you have postmenopausal bleeding, make sure that this is not a uterine cancer kind of sign that needs to be watched out even in postmenopausal women. Finally, take care of, if you feel that you have anxiety, depression, get yourself care. The mind matters. So as a result of that, these are the few pointers. It's important to relax. It's important to sleep well. Remember, taking care of all of these things can help you with future outcomes as well.
Thank you, Pia. Dr. Shilpa, now there's so many diets. There is intermittent fasting and there is keto. What is your opinion for PCOS specifically? Do you advise this in PCOS?
So this is an interesting question, and I know there are few doctors here, but there is a very nice paper which has come in one of the medical journals, which compared all kinds of diets which are available, and they were deciding which one is better for people. And what they concluded is every diet works as long as you follow it. The problem is people go try one thing and they want results in one day. And if it doesn't happen, then you switch on and you go to the next diet. So the first and most important thing is follow a diet. That's the first important thing. And get it from somebody who understands about nutrition and not download from a Google, because that's another problem. As far as keto diets are concerned, not that they don't work, they work. But the problem is sustenance of these diets. So you can't do keto lifelong. And like everybody said, PCOS is a lifelong problem. So if you're going to look for a diet for it, you need to look for something which is very sustainable over a longer period of time. So keto diets are not sustainable, at least in India, especially if you're a vegetarian. It's really, really difficult because you can't be eating almond flour all your life. You still need to eat food. And as far as intermittent fasting is concerned, it's really, really good. There are set of people in whom intermittent fasting works well because it's really not a diet. It's in fact skipping one meal, giving a longer period of hunger. So it's a great way. But then what is very important is once you stop fasting, what you do. So people are very happy fasting for 16 hours. And then they directly go to a vada pav stall and buy a vada pav, 16 ghanta ho gaya. So that doesn't work. What you eat after you have done with your fasting is very important, but all kinds of diets work. It's not that a particular kind of diet works.
Dr. Bindu, you have already told us about the kind of, quick fixes which people want. Nowadays, we are seeing a lot of adolescents who come to us, they come alone also sometimes. So what do you recommend with cosmetic procedures like, laser hair reduction? If a girl is coming to you at 15 or 16, and do you send them to a gynecologist first, or do you ask them to wait, or how do you go about it?
When adolescents come, first of all, if they are only coming, say, for acne, or if they are coming to me for hirsutism, of course, I explain to them, but I never start any treatment if they are under 18. They have to be accompanied by their parent, number one. Number two, now adolescents, yes, they are very savvy and very media savvy thanks to social media. They come directly and they come and tell me that, doc, I want this. I want laser hair removal, or I want my acne. Or if they are obese, they'll straight away come and say that I want to lose my fat. I want you to help me with lipolysis. So because now they are media savvy, they get all the info on Google. They do come and they tell me this. But of course, under 18, they have to be discouraged, number one. Number two, I always give them that, okay, they have a symptom of acne, they have a symptom of, say, even obesity or hirsutism. It's only a symptom, it's only a tip of the iceberg. It's only 1/3 on top and 2/3 below, so they have to be examined, they have to be investigated. In fact, nowadays I'm seeing this very often, and I would say about 6 months ago, I got a 14-year-old girl with her mother had brought her, and she had darkness around the neck and even around in the underarms. And every mother thinks that my child is not cleaning herself properly. But that is not so. This is one of the signs of insulin resistance. We call it acanthosis nigricans. So first of all, I had to explain to the mother that this is not because of dirt, or it's not because she is not washing it properly. It's one of the signs of insulin resistance, as Dr. Pia has said. So you have to be told that these are one of the markers. So when I told her that she may be having insulin resistance, and she was not obese, she was just mildly obese, and moment I told her that, look, this is insulin resistance and probably pre-diabetic, later on I came to know, the mother told me that she went home and from that time onwards, she got bulimia. That means whatever she would eat, she would secretly go to her bathroom, put her finger in her mouth and throw it all out. This is what was triggered. In fact, the next time she brought her to me, the mother told me, please do not tell her all this. So, she had to be sent for counseling. She goes for counseling. So, adolescents nowadays are at such a state or such a stage, they do have body image, negative body image. They want to look like the actresses, and they don't know that these are all photoshopped. So they will come and tell me, "Doc, I want a figure, I want a slim figure, and I want you to help me." So I do tell them that these are signs, you have to be investigated. I follow generally a holistic, multidisciplinary approach because many systems are affected. That's why it's called PCOS, polycystic ovarian syndrome. Earlier it was PCOD. Therefore, if they have to be investigated, once they are investigated, I tell them, of course, do your exercise. The 3 pillars, what we say, is diet, exercise, and sleep. Nowadays, even sleep, they sleep only for 4 to 5 hours. So all these have to be corrected. They have to be investigated and sent accordingly either to a gynecologist or to an endocrinologist, or like this patient who had bulimia, she definitely needed if I mention a psychiatrist or even counseling sessions. So PCOS is, remember, always a multifaceted, multidisciplinary approach. So in fact, educate your kids and educate your friends not to say, "Oh God, you're sending me to another doctor." It has to be treated by multiple departments and multiple doctors to give you the right treatment and the effective treatment.
Thank you very much, Dr. Bindu. You've really put that in a nutshell. And I can see Vinita now signaling that we have just last 2 questions. And my question to Dr. Twisha is very, very specific. You have a patient who has never exercised before. What is the exercise that you would recommend and how much?
Like we do for any medical prescription, exercise is also a prescription. So we would first do a small test on her, which is called a fitness test. So we would assess her on the various parameters. So exercises are aerobic exercises, resistance exercises like Dhruv ma'am mentioned. So we do a basic test for her, and on that basis we decide what is her level today and what can she do. So, and what is her other comorbidities. So if she has an issue already with something like she's got a knee pain that every time she walks or she climbs stairs. So climbing stairs is something very frequently which is advised to people. But if they are having some knee issue, the climbing stairs will worsen the pain. So that's why we would come in as a sports medicine physician, that we would do an assessment, a medical assessment, a fitness assessment. On that basis, give them a prescription. It will be always a combination of aerobic and resistance exercises and some flexibility exercises. So it's usually that combination. Of course, simplest is for people to start walking. And in the young girls, it's usually not a problem. But then what we need to tell them is how much to walk, how fast to walk. Because we definitely see in our societies and on Marine Drive and everybody, obese people who've been walking for years together. So, there's a lot of things which go into just that walking also. So, your speed and everything has to be. And all of that can again be decided on the basis of the fitness prescription, of the fitness test. I cannot ask them to walk at 6 km per hour, whereas today they can only do 3 km per hour. So that's what it is.
Dr. Sapna, so I think you'll have the last word about, are there any heads in which you categorize your patients, and what is this motivational interviewing which we all hear so much about?
So HEADS is a psychosocial holistic assessment used mainly for teenagers. As we are seeing, nowadays there is a lot of issues that the teenagers face. So we have to go through systematically through all the issues, and some of them, other than the medical history that we ask, it is the home environment, it is their eating patterns, it is the education, so which school they go, which college they go, what is it like, is there any bullying happening over there, it is the peer activity and hobbies that they are, they are indulging in, any depression or suicidal thoughts, any drugs or alcohol, social media usage, which is the newest addition to that, and any kind of sexuality issues. So that is in a nutshell about what the HEADS assessment is about. And I think the last question was motivational interviewing. Motivational interviewing is a client-centered type of counseling in which, rather than prescription, to say that, you have to exercise or you have to eat a diet, you have to do this, that and the other. And a lot of times people come back saying, we tried, but they were not compliant. We didn't come, we couldn't do it. So this is working on the motivation of the client. So there is an algorithm called RULE in that, which is rolling out the resistance, understanding the motivation, listening with empathy, and the last one is empowering the client to lead a healthy life.
I think this is great, and everybody's given a lot of inputs and valuable information. I thank all our panelists for the superb panel discussion, and
Sarita, that was a wonderful panel, very informative. Now, we are already running late, so I will move on to the next panel, and I will invite Dr. Durusha. She is going to moderate the next panel, which is called Bringing PCOS to Center Stage. Thank you, madam.
Thank you very much, Sangeeta. I think we go to the next panel, which is a very, very interesting panel. You'll have met all the doctors before this. Now I want you to meet of course there'll be doctors too, but they are more into healthcare, and they are the ones who are taking care of our health in terms of making policy decisions, doing things for what we need in our lives. So in short, I'm going to first of all call Dr. Chavan, who is our Deputy Director of Health Services, Maharashtra State. And he's I can compare him to our to our Prime Minister, Honorable Prime Minister, who has risen from a chaiwala, and our Deputy Director has risen from the family of farmers. And I think I appreciate your coming here. Please have a seat. So we have Dr. Chavan, who was born in a rural village of Maharashtra with a population of less than 1,000. He has done his MBBS and MD in preventive and social medicine, and he's done it from the Grant Medical College, both his undergraduate and postgraduate, Sir JJ Group of Hospitals. Luckily, I also came from the same hospital. He's currently the deputy director, but he's gone through a lot of other positions, which has been assistant director, health services, district health officer at Wardha and Yotmal, district RCH officer. So lot of initiatives he's done, and lot of experience in the villages itself. And I think he's the best person for us to decide how we can take PCOS center stage, what we can do for our patients so that they have all access to everything. We all know in the private health sector, we can go to the different specialists who are sitting here on the dais. But how many of our women who cannot really afford to go to the private sector, in the public sector, how do we take care of them, and how do we do the best for them? Because they have the same problems as the women from the urban sector. Next, we have a panelist, is Dr. Vyoma Dalal, who is also a doctor, and she's from the field of public health and nutrition. And she's from UNICEF. We have all heard of UNICEF, which is one of the largest non-profit organizations which deals with women's health. And she has been a technical consultant for maternal and child health nutrition. Why we have her? Because we know nutrition is extremely important right from childhood till adulthood. And therefore, she's going to add on a lot to what we need to discuss. And she has also worked in various areas like urban, tribal, rural. These are the various areas she has worked in. And she's collaborated closely with government counterparts to enhance district outcomes for children. She's addressed health and nutrition risk communication, and she has been ensuring interrupted provision during the COVID epidemic. She has helped a lot in getting things done at the ground level. So welcome, Dr. Vyoma. Then, of course, we have Dr. Beena Joshi, who's from the ICMR. And this is the institute which is research in reproduction. And we have, give them all a big hand because they're all doing a lot for us. So Dr. Beena Joshi is a senior researcher, deputy director at the ICMR's National Institute of Research in Reproductive and Child Health, which is very close to the KEM Hospital and Wadia Hospital, where I trained. And I was a frequent visitor at the NIRRH. I had a lot of friends. Unfortunately, they've all retired. I still haven't. But yes, I know Beena Joshi very well because we have worked together in something what we created as the PCOS Abhiyan, wherein the ICMR, the Tata Institute of Social Sciences, Kasturba Center for Research, which works on Ayurvedic treatments, and the PCOS Society of India combined together to create PCOS Abhiyan. And we have been doing some work together and done quite a bit towards PCOS. So our research interests are in the areas of adolescent health, preconception care, polycystic ovarian syndrome, contraception, and HIV. She has vast experience in doing a lot of research, which she has been doing in various areas. So I have the next panelist. I will call her. That's Pooja Bedi. She's got a great namesake. Excuse me, can you move this out? Just move it out, please. Thank you. Thank you so much. So we have Pooja Bedi, who's come to us from she's a Bachelor of Law, Bachelor of Economics, and Secretary and Executive MBA from China European International Business School, Shanghai. She's a leading general counsel and compliance leader. She's a lead for CSR at Philips, India, and she's in charge of making sure that all goes well through that CSR projects. And that is something she is a legal person and makes sure that everything is going well and everything is done with integrity. She's passionate about leading with integrity and has been championing the role of business's voice of conscience. So she is associated with Philips India, and she has been responsible to some extent, I think legally, to see to it that the Vijayata project, which is run by the PCOS Society of India, which is a CSR project, the Corporate Social Responsibility Project of Philips India, which we are partnering with, and we are carrying out this particular event today, even through that project. So then we have Mrs. Malika Parekh, who is, again, double masters in public health and medical science. Mrs. Malika has had a 2-decade-long career in research at the New York Presbyterian, and she's an advisor into healthcare systems and hospitals nationally across the US, and leading strategy in healthcare finance. She did her public health fellowships from Mass General Hospital, and her master's thesis was how to increase patient information. And that's why Malika is here to tell us how we can increase patient information, how we can work in the public health space. So we have got people who are excellent in their own areas, and we are going to listen to them as to what they are going to do for us. And last but not the least, we have one of our consumers, one of our PCOS patients, who is Purnima Thakur. And she's a legal advisor and intellectual property lawyer, if anyone wants to go to a property lawyer. And she practices at Mullah & Mullah and Craigie Blunt & Crowe in Mumbai. Her core focus is advising clients in media, brand owners for which she devises strategies. So Purnima has been a patient of PCOS, and she's followed it brilliantly over the years, and I want her to share her experience of how only lifestyle can change your life. And I think that is something I want to bring to you today, and have this panel discussing the various options we have with us. So in short, I'm going to start with the background on that this disorder we all know is affecting millions of women in India, and how it's going to affect in future, how it's going to affect women's health. Nobody's taking interest into PCOS, and that is something we need to bring center stage. So first of all, I'm going to speak to Dr. Duryodhan Chauhan, as he's the health director for the public. And I think you have heard all the problems which are associated with PCOS patients. And I want to know how we can influence the government to assist women to manage this disorder in all three ways: physically, mentally, and financially. Because every woman who comes to a government hospital cannot get the care which she's getting in the private sector because she can afford it. But can we do something in the public sector, like set up a PCOS clinic, or set up something where all these facilities are available in one space, where patients can make use of it and be benefited from it? The biggest benefit to the country will reduce diabetes in our country. And that is extremely important, because it leads to cardiac problems, it leads to obesity, it leads to so many issues in long term. So Dr. Chauhan, tell me what you can do for us.
Yes, madam. As we are all aware, and we are listening about this disease since last 1.5 hours, and many of us are already knowing about the seriousness of the disease. It is a kind of disease which is usually hidden. It is not diagnosed as early as it is expected, and awareness is the main issue. If I am not aware about anything, then I don't ask for that thing. First of all, we have to generate the demand in the community for that getting diagnosed for that disease.
Yes.
Being a government, actually, we have launched national health program. It is called as Rashtriya Kishori Kishore Swasthya Karyakram. In this, we are counseling adolescent girls and boys, those who are attaining their adolescency, and special clinics are arranged for there at rural hospital level. So it is very necessary to go to individual level, and it is not possible for government alone to reach each and every person who is required that service. So it will be better if we participate in government system. We are having, madam, one PPP project, public-private partnership. Through that project, NGOs like our PCOS Society and other NGOs, they are joining us for implementing this program effectively in the community. So RKSK is the one platform where we can join. And another platform, as we all heard just now, diabetes is the main cause, or it is aggravating factor for PCOS. So for NCD, we are having separate program in which diabetes and hypertension, it is well looked after. But it is for 30 plus population only. So RKSK and NCD together, we can go ahead to in controlling this PCOS or management of PCOS patients.
Yeah.
Thank you.
So thank you very much. I think you have done a right thing by helping in how we can correct these, keep it under control, correct the problems, have a clinic with public-private partnership.
Yes.
And can it also be done in the cities, or it's being done only in the villages?
Right now we are basically I am working for rural area.
Yes.
In health sector, we are having 3 different agencies. I am working for public health department, who is looking after district and rural area, and corporation is having their separate infrastructure in urban area, And now government has in Mumbai corporation and other corporations also, they have started new free scheme for patients, for every patient, free of cost treatment. It is called as HBT Apla Davakhana. That means Hindu Hriday Samrat Balasaheb Thackeray Apla Davakhana. That is the name of that institute, which is run in slum areas, especially where there is much need of service delivery to the poor people.
Okay.
That is one thing in urban area. So if you are interested to work in urban area, we can I can help to reach the corporation authority. And another health sector in our Maharashtra is that is medical education and research. That ministry is separate. So we medical colleges are administered by them, and we can together we can reach to all the patients, those who need the treatment and other counseling part.
Yes. So yes, in government hospitals, you can run a clinic which is a multi-stakeholder clinic wherein the doctors from the different departments collect on one day in a week and see the patients and guide them and help them. So that is the thing what we should look for in the future. We will see it, I'm sure. I'm going to go to Dr. Vyomi, who's at UNICEF, and she's working on nutrition mainly in children. And I know that it's been well known now, scientifically proven, that if you have a child who's more than currently 5 to 6 years old, and you find that that child is not losing weight, on the contrary, putting on weight. Because as children grow, they get active and they don't put on too much weight. They are active, they are healthy. But if a child is going on putting on weight after the age of 5 or 6, that's a red flag for you, because this person is likely to become obese in future. So nutrition and children is something which is your expertise. So what would you recommend to parents of today as to what does UNICEF want to do for those mothers who only talk about their child being, not chubby, my child is looking very thin. They are not interested in knowing whether child is healthy or not healthy. So what would you recommend for these kind of
Thank you. So if we see recently the last NFHS, that is National Health Survey, which has happened.
Is the mic okay?
Hello?
Yeah.
Is it better? Yeah. So the survey says that we are seeing an increasing trend in obesity, even in rural as well as urban. Correct. So I guess now, maybe in another 5 to 10 years, we cannot really say obesity is the disease of the urban. It is everywhere. And as very rightly you said, I would say that everything is a life cycle thing where we should use the life cycle approach. And the way you just mentioned that it does start way before, right? In pregnancy itself. So I would take one more step before that is adolescent, preconception, then during ANC. So right now, currently what is happening is we are missing this PCOS at many levels. And even in the government setup, it is usually we do all the tests and everything is during the ANC period. So if we want a healthy child tomorrow, it needs to start way before that. So we need to look even PCOS in a life cycle approach at all levels, right from childhood to adolescent to a mother, like maybe during pregnancy and post that, because as very well said, it can cause diabetes in the future. So firstly, that is something which I would say. Secondly, early screening. As public health, the most important thing which we say is health promotion, and you have to prevent the thing. So yes, screening, because many places, though in urban, it is a very well-known thing, and still there are doubts. Like the previous panelist did say that it is a taboo, right? When you say PCOS, okay, then I'll not be a mother. So it is very important that even in rural and urban, the right messaging goes by. So I would just suggest, or I would just say, along with this, when we're talking to the health department and the various programs of the health department, Maharashtra government is even going to sooner or later start with the preconception. So that is one place where we can advocate and even start PCOS screening as early as that. Secondly, develop easy intervention packages even for the government. where we can say that this is the bare minimum which we do, and at least we start screening and referring ahead to specialists.
Absolutely.
Right? So these are the two things which I think.
Absolutely. So, what I would ask Malika, since you were in the US for a long time and located now in India, tell me what is done in the US. What kind of programs do they run? Public health awareness programs for women, for women's health in different areas. If you know anything about what they do for PCOS, particularly, will be great. But otherwise, in women's health, how do they promote public awareness?
I think it's on. Yeah.
Yeah.
I think one of the main things that we have to focus on here, which I would take from my experience there, is educating educators.
Yeah.
So we have to make the people in schools and universities aware that this is a lifetime disease. We're looking at the incidence of heart attack and cardiovascular disease, diabetes, insulin resistance increasing in womanhood. We're not realizing that it could be, PCOS could be the trigger and that it starts so early. So one of the things that I think is educating the educators, educate the universities, the administrators, the colleges, the schools, the parents. During the pandemic, we had so much communication go out about vaccines. Every school, every parent was paying attention to what is happening in the vaccine world. And all of a sudden, we've all become experts on vaccines. In the same way, we can piggyback off of communicating with parents and with administrators and with teachers and inform them about conditions that is ultimately a condition that is going to impact a woman throughout her life. It will impact productivity, it will impact society ultimately, and economies if we don't nip this in the bud and inform people early. So I think it's a lot of partnerships, partnering with public health programs, having schools partner with public health programs, have those programs have their graduate students do internships. Everybody in a graduate school has to do an internship or a fellowship or a thesis, have them do it in education, have them educate schools and educators early. Work with fitness companies, work with people that do this for a living, and figure out what types of workouts, what types of exercise could be good for children. Understanding that it's not just cardiovascular exercise, it's not just strength training, as you said in the previous panel. It's a combination of the two. So I think making them aware that it's lifestyle changes that start early on and educating the educators is really important.
Absolutely. So start early and educate the educators, that is the doctors who are talking to patients, or even teachers, even parents. They also are educators at home and in school. So I think keeping all this in mind, I think Philips India has taken it up as their CSR project for educating doctors and educating mainly patients. They are focusing on the patients, and that's what we are doing through the PCOS Society of India. So what do you think is the next step? We have just started the awareness. What would you think would be the next step we should go, besides talking to women at large, besides talking to parents, besides talking to so many people?
So thank you so much, Doctor, for having us here. We're extremely proud, and I'm extremely proud to be representing Philips here. Although I'm a lawyer and my day-to-day involves around business lawyering, but CSR, ESG are core to how we do business at Philips. So unless we are giving back to the community, it doesn't make sense. So one is the profit and loss statement, but there's also then account of how much you are doing with the communities and what are the issues that the company is standing up for. So I want to emphasize that not just this project, corporate social responsibility or environmental sustainability is at the core of what we do at Philips every day. And we will only try to do or accelerate as we go along the way. But I think you ask a very significant question. I know we're a very large country, and I know the problems that the government has to manage the amount of work that is required on access to care, access to health care mostly. And I think it's an evolution, it's a journey. We can't expect to change everything in such a large geography. but I think the government is focusing on primary healthcare sector, which is showing its results. And I think as we move along the way, these nuanced issues, these more sophisticated issues, will also find a platform. But I also want to, take some responsibility myself as a citizen as well, and would like to leave this message out, is I think we need to teach our girls to ask for more. It starts from them claiming. So we can run programs, we can, do awareness sessions, we can share information, but they need to have the ability to grasp that information and ask questions, ask for more clinical research, ask for more information around why nobody's bothered to look at this syndrome more holistically and put the dollars that are required for the research piece. So I think as part of a larger organization, we can't solve for everything, but it's a step in a direction where we want this dialogue to happen, which thanks to you is happening quite well. But take it to a level where we can really make this as a center stage conversation, and women driving it, and women making choices to say, okay, this is for fertility I want to do, or this is for, just taking care of my body or being fit. But I think we're still far ahead from that.
Yeah, we should that. And I think that's why we have more women on the stage just now. I'm feeling sorry for Dr. Chavan. He'll have to answer a whole lot of women. So coming to research, I think Dr. Beena Joshi has been leading research on PCOS at the ICMR. So what has, I know there's a 5-year study going on, and I don't know if the results are out. And what has been your experience in this research?
Thank you, Dr. Durusha, for inviting ICMR on this platform, and congratulations to Philips for considering this as an initiative to take ahead, and all the best. As much as PCOS is multifaceted and it requires multidisciplinary approach, the research also needs to be multi-pronged, and we are fortunate to have different capacity trained researchers at ICMR who look at different aspects of PCOS. So the basic researchers are addressing what are the genetic and epigenetic changes and polymorphisms in the genes that are involved with PCOS, and also looking at how it affects the quality of oocyte due to PCOS. So there are very insightful, observations, and we also have a bioinformatics group that has collected all the data of all the genes involved with PCOS, and for researchers and young scientists, I think that is a very good database. So from the clinical perspective, we have a multidisciplinary clinic at the institute, which is based across KEM in Parel, where once a month we conduct a PCOS clinic, which is a holistic, where we have dermatologists, psychologists, nutritionists, a yoga expert, and also the gynecologist looking at various aspects of PCOS. And we have a good data of around more than 500 cases now, and we have several research publications from that data. One very interesting aspect is on how health-related quality of life is affected, and how obesity and anxiety, depression affects quality of life. Also, we try to assess the coping mechanisms, as Madam was already pointing out. So they use maladaptive coping mechanisms, and that is where counseling is most required. We are also trying to look at international guidelines to see how they could be adapted to meet and what can be done at public health facilities, say PHC, what can be done at district health settings. So how to adapt those guidelines that are already available in Indian context. This is one work that is ongoing. Now, one big strength is epidemiology. So we were one of the first studies published on community-based prevalence among adolescents. And we have reported very high prevalence. Of course, it has been a decade now, almost. 22% using Rotterdam criteria, and surprisingly the population that we went to, we had a lot of lean PCOS, so that is something unique in our Indian setting, as you mentioned. ICMR also has recently conducted a very large study across 9 states with almost 10,000 sample size
to assess what is the prevalence of PCOS among 18 to 40 years of age group, and the results are just out. So we have found a prevalence of around 19% overall, and surprisingly the prevalence is not so different in urban and rural areas. That's very sad to note. It's just 1% less in rural areas. And again, we see thin PCOS, lean PCOS more in the rural setups. But of course, there are quite a few obese PCOS as well. And as Sir was mentioning, we need to really create awareness and demand for services in the rural areas. While we did this study across different centers, we also looked at the health system's preparedness to, deal with PCOS, and we realized that many PHC medical officers and gynecologists at rural and sub-district hospitals did report large numbers visiting these facilities for PCOS symptoms, but they lack training, they lack guidelines or training material, or even IEC, the information education component is lacking. So a lot of work needs to be done at that level. Of course, preconception care is something that we have been working, and PCOS is something that we have taken up. We are also looking at cost effectiveness studies. So that is a lot of health economics also needs to be considered. So we have a 5-center study now where we are looking at health system cost to diagnose and manage PCOS. We are looking at infertility basically, but also what is the out-of-pocket expenditure and the catastrophic health expenditure that these patients incur, and also quality of life. So now if we have all these parameters, we can do some modeling exercises to see different treatment or diagnostic protocols, and to recommend to government what is the best cost-effective, treatment protocol that could be used at PSCs or other settings. So these are some of the highlights.
Madam, I wanted to narrate our difficulty. As Madam rightly said, training of gynecological examination is a big challenge for us. Even I am seeing that the medical officers, those who have completed MBBS from private colleges and from government colleges too, they are not very confident about examining these, doing gynec examination. This problem we have faced while in NCD, we are having cervical cancer.
Yes.
Diagnosis of cervical cancer by VIA,
yes.
visual inspection
Yes.
acetic acid. That test was also not able to perform our medical officers. So we have to train them. Skilled manpower is a problem in public health right now also,
Yes.
from government side.
No, I totally agree
Yes.
with you. I've had that experience. I did a project in Latur district where we were looking at non-communicable diseases in women above the age of 45. You won't believe it. I went personally, and there we asked them to take pap smears, just pap smears. The doctor said, we will not take it because, they are guys and most of them were men. They said the women won't allow. The nurses say it is not my job. So we were in a fix. We didn't know who's supposed to take the pap smear. So in short, what I'm trying to say is that we need to strengthen our systems. Yes, and at the same time, yes, you'll have used, societies like, say, Foxy to promote VIA. We are there for you for PCOS. Anytime you need our support, we have got 1,500 doctors with us, and we are happy to support in training your public health officers. We are happy to do that. So in short, we are, as a public-private partnership, it's a good thing to get together and share our strengths, all of us. That's what we need to do. And yes, economically, Dr. Beena Joshi, economically, if we allow these women all to go ahead and become diabetics, it's more burden to the country rather than treating them now. I think it's very important for us to prevent those cardiac deaths and prevent those, all the abnormalities or the problems which occur. So we've had a very good consumer here with us, who's Purnima Thakur, who has been a patient of PCOS, and she's happy to share her experience as to how she has managed her life and how well she's done it. Tell us.
Thank you, Dr. Shah. And I have to say a very big thank you to everybody involved over here and elsewhere who have really focused so tirelessly on working to solve this issue, which is actually so silent and which so many women suffer from. And I have to say, I've been such a fortunate beneficiary of this. My PCO was discovered really quite by chance. I did not even, I mean, I'd never heard of it. My mother hadn't heard of it. A very dear friend, her mom happened to be a gynac, and every other month I would have the most painful periods, so much so that I would throw up. And I was in my early 20s. And I think this thought that you have to suffer through the pain, it's just a very common thing, you know. I mean, everybody has done that. And I remember when she told me that, you know, let's just get you checked up. And it just seemed like such a daunting thing because a girl in her early 20s, like some 30 years ago, just seems a bizarre thing. And she'd come with me to get my first scan done. And it did seem like it was PCO. And then my mother had taken me to Dr. Shah. And I think what we've been talking about is, you know, like Pooja mentioned, the responsibility of women to be, the thought that you're going to be responsible for it, to get more information, because really the information is there in little pieces, but the education, you know, of not just the patient, but even the people around, where this whole stigma that comes in, because it has to do with reproduction, you immediately, somewhere some people don't want to know more also. It's like, let's just treat that acne, I'll lose some weight. But I think what's helped me greatly is just being consistent in that, listening to the professionals. And in many ways, things kind of seem like very clinical. Like when I was planning a baby, to be told that you have to do follicle studies, it just seems like such a bizarre thing, right? Because it's all supposed to be very romantic to get pregnant and everything, and it's just supposed to happen. But really accepting the fact that there is medical help there and it's not the end of the world. It doesn't define you. You just need to make sure that you're disciplined. And I think the more we talk about it, I know we've talked about women being responsible for it. I think it's all of society, and that's why it's so wonderful that, you know, Dr. Chauhan is here for this also, and we actually find everyone in society taking responsibility, because in so many ways, it's like, for example, my father was completely taken aback that I had to be put on a pill to solve this. So, or even that when you have to take metformin, it's like, oh, do you have diabetes? So when you actually speak to somebody to get your insurance, they are a little confused about what's happening over here. Are you making an all disclosure about what's happening because you've said you don't have diabetes, but you're taking this medication? So I think as a consumer, I think educating people across the board, and of course women being responsible, not being scared to ask those questions and to find out more, because as you find out, you can treat what you need to.
Thank you, Purnima. But those were the days 30 years ago. Yes. Question today is we have Google patients. And they have already read things and come, and then they create trouble for us, in short. So there are some doctors who put a poster outside saying, no, I'm fine. They have a poster saying that if you follow Google, please don't step in. Simple. So you don't need to follow anyone else. So, you know, luckily for me, I have been on the C20 committee of G20 for Women's Health Vertical. And my suggestions there were that we should introduce physical activity in schools every day for 1 hour. That should become compulsory in schools, because mothers today are only focusing on academics and classes, etc. I think that's very, very important for our children to have that 1 hour of exercise every single day, compulsorily in school, so that the mothers don't differ from it. And I think physical fitness is so important, and I want Malika to talk about it as to what you think about physical fitness. She also is very much into physical fitness. So I'm asking that question to you.
Sorry, just repeat the question.
No, the question is that we have so much of, you know, academics focus on children, and we don't encourage physical fitness in our children, because most of the schools, and, you know, the children come home, they quickly eat something, go for tuitions, Then they are on phones, they are on computers. They have no time to, have any exercise. So what I'm recommending is that we introduce physical fitness in schools as a compulsory subject every single day. So you tell me what we can recommend to the government.
Yeah. This is obviously a topic close to my heart. So I think there's so many misconceptions when it comes to physical fitness and young children, adolescents, young adults, and adults, especially when it comes to women's bodies. One of the things that was said on the last panel as well is that for PCOS, for most conditions, for most disease, but also for PCOS, cardiovascular exercise plus strength training exercise combined is very important. Now, a young girl's mother would say, I don't want them to lift weights or do weight training exercise. They're going to gain too much muscle. They'll bulk up. That's a misconception because you require lots of testosterone to bulk up, male levels of testosterone. So young girls, in fact, strength training is obviously important for insulin resistance, as we discussed, but strength training is important with cardiovascular exercise because you're burning calories at rest. When you're doing cardiovascular exercise, you're burning calories. But when you do the strength training combined with that, you're burning calories at rest, which means that your metabolism resets. You have more effectiveness in your exercise. With respect to kids and young adults, one of the things that parents might often forget is that during puberty, during female puberty, we go through so many physiological changes that throws off our center of gravity completely. Fast forward to pregnancy, the same thing happens again. So if you develop this habit of exercise early and you're working on exercise that is cardiovascular, strength training, flexibility, postural, then you have this habit that's already ingrained in you. So when you go through these physiological changes during puberty, during pregnancy, and then post, and then again during perimenopause, you have the strength to withstand those stages of life, I would say. So informing them that puberty, you should not shy away from exercise. In fact, that's a wonderful time. It's great for bone density. It's fine for it's not going to stunt their growth. It's not going to cause them to bulk up. It's important to incorporate, all types of exercise. The other thing is mind-body exercise. So young kids, adolescents, again, they're dealing with so many things from, menstrual cycles and peers and academics. And then if they have PCOS, the things that PCOS, sort of how PCOS impacts our mental health. Exercise is helping us curb that. And I think that needs to be brought to the forefront. I mean, it's been said many times today, but I think, again, in educating our educators, educating the parents, we need to make them aware that exercise is so important for sleep, concentration, focus, mental health, in addition to all of the physical benefits that we talk about.
Yeah. So I think if they start from school and get into that habit of exercise, I think it's extremely important for young children to, get into that mode of exercise. And making it, according to me, it should be compulsory in schools for an hour every day, and that will go a long way in preventing obesity and overweight in our children. So I think that is coming to physical fitness and even nutrition, I think. Dr. From UNICEF. So where I'm talking about is nutrition is that what kind of nutrition do you think we should be giving our children to prevent them from getting overweight in future? Because we all know that being overweight or having obesity is going to make matters worse for PCO patients. So how do we prevent that from happening? What kind of nutrition would you recommend in the canteens in the schools?
All right. So it's basically nutrition related question, and thank you for asking because I think it's really important that we started way before. When we are working even in the deepest communities like tribal places, when we make them aware what is the right nutrition, and if we start indulging it in way before, I think one of the panelists before mentioned that if we start doing it since, say, the child is 2 years plus, or maybe I would say before that, the child gets habit of having proper nutrition, right? So it's very important for us to really advocate it even to the mothers, what nutrition needs to be given and how, why balanced diet is important, or why proteins, like one of the panelists just mentioned that, and unfortunately in our Indian diet, proteins is not the part of the diet. So what proteins, whether you are a vegetarian or a non-vegetarian, needs to be included in the diet. In the communities, we usually try to tell them that a balanced meal is important. And even in schools, the way earlier it was mentioned, that even in school, the diet needs to be very particular. Canteens nowadays, most of our canteens.
So that's what I'm asking you. In canteens, what should we recommend? Because they have samosas and they have batata vadas and they have chips. I don't want that in schools. I think that the decision has to come from the public health authorities that no fried food, no sugar food should be served in school canteens. I think we can start from there. If there is a policy decision made that this is something we will follow in all schools, automatically the schools will follow it. You see, it's easy for us to tell the parents, don't give this, but when it's not given in the school canteens, it will start from there. I think that's another message.
From the parenting aspect, where we tell the parents,
Yes.
and then it goes to schools where even what we teach should be seen.
But what the child learns in school will teach the parents at home. It's also the similar. I think Dr. Chauhan, you should tell us what happened in G20. At G20, did they pass anything for women's health?
Basically, Madam, I will, regarding this canteen issue.
Yes.
Basically, as you rightly suggested, if one of the dietitian panelists, Madam, she has mentioned that Indian food is not very rich in proteins.
Yes.
So, for school canteens, we can ask the school authority to prepare such a menu that contains high protein. That only will be served in that canteen. So that can be done.
Exactly.
And secondly, or otherwise, from the school authority in public health for this tobacco control, we have made it compulsory. There will be no tobacco selling in 100 yards of the school.
Absolutely.
Yes.
So that's
like
what
that, we
needs to be
can
done.
suggest some for this canteen also.
Yes. You can give sing chana. That's very good, high protein. Yes, Dr. Beena.
Add one more thing. In fact, in ICDS, that is the Anganwadi, that is the school of preschool which the government provides, even there, after years of advocacy, now we are supplying pulses also.
Correct.
If you see our PDS system, the PDS system only used to give carbohydrates like rice and wheat.
I know.
But recently, in last 2-3 years, even pulses has been a part of the cycle. So I think you are correct. And just to add, which I did not and you rightly mentioned, was in tribal schools. As UNICEF, we had done a lot of programming where we have started nutrition gardens in tribal schools. So healthy food grows there itself and is supplied to the school, and there's no funds involved in that.
No, I had gone through that project which was done wherein the food was being supplied in the tribal villages by the NGOs working there, and the food was assessed for the nutritional content which was very, very poor. And this was done by the Tata Group, I know that. Yes. And they were the ones who brought out this fact, and they started supplying food through their own kitchens. I can't remember the name of that project, but that is what they did, and I thought that was brilliant, absolutely brilliant.
Even actually encouraging children to have a Nutri garden in their own house or in schools along with teachers and parents.
Absolutely. Yes, Dr. Beena, you were
wanting to add that there is a Amrut Ahar Yojana from a municipal corporation which is functional in
which Yojana?
Amrut Ahar Yojana. Even in municipal corporation of Greater Mumbai, all the BMC schools up to grade 8th or 9th standard get midday meal sort of, food. And we have seen a couple of times that it is a very balanced sort of diet. So I think there are initiatives and intention to, move in this direction, which needs to be strengthened and encouraged.
So I think we have a lot of facts together, and the policy should be that these are the facts which we should try and bring out into the public domain. As NGOs, we all do our little bit of things, whatever we can do. But yes, whenever you want something to become a part of the lifestyle of a person, it has to come from the top. And that's how we introduced adolescent reproductive sexual health in the school curriculum. By first showing to the government that by going to schools, we did it for years and said, this is how it's helping the girls. Then it became a law. It became part of school curriculum. So I think you all have the power to do it, Dr. Chavan, and I would urge you to do something for the PCO patients. It's very, very important. And I think for Pooja, I have a suggestion. You all are into innovation. You think you can do something for the PCOS patients as an innovative project?
Okay, so I don't know how many of you know here, but Philips today, as we know, Philips is a healthcare technology company. Yes. So over the years, we've been into lighting, we've been into domestic appliances, but today, if you ask us, our core focus is healthcare, access to care, and medical devices, most of the medical devices, and I have a team here who also do the selling of it as well. And they would tell you that all of you doctors are our, beloved customers because we have medical devices from all the spaces, from OB-GYN, ultrasounds to MRI to cath lab, etc. And innovation is at core of Philips. In fact, our tagline, our brand marketing is around innovation and you. But I think Philips also believes in a philosophy, doctor, where innovation needs to be meaningful. Correct. To be able to address the unmet needs of people. So I can tell you, and without sharing too much, women and child healthcare is the focus at Philips right now. In fact, we have a large Philips Innovation Campus. I don't know if you guys know it, but we have about 5,000 plus people, data scientists and engineers focusing on doing healthcare innovation. And Femtech is the new sort of digital healthcare space that we are designing on. We're still very, very nascent there. We're still making an effort. We're just starting. But like I said, Philips would like to provide help or address the needs of an addressable market. So we just don't want to come out with an app for just selling an app because there are many apps out there. But we would like to really build an ecosystem around how do we tackle the disease intrinsically. Like everybody said here, it's a syndrome. It's not like, it's not something that you can take a pill and you're all right the next day. It needs a lot of work. It needs a lot of intervention. And I think Philips has picked up this one as a subject. And let's see where it takes us. But the intentions, like you said, are already there.
Absolutely. So I think if there is anything else, anyone else would like to speak here, then we'll open to the floor for suggestions.
Yeah, you mentioned about Abhiyan PCOS initiative. So one thing that we tried but we couldn't, I want to put across, is forming a PCOS support group. Yes. I think that is very, very essential, and I do not know how to go about. We tried a couple of ways, but it somehow didn't materialize. So this is something I'm want to throw open for further consideration.
That's what we are working on. That's what, when we are creating this awareness amongst PCOS patients, we are having a database of patients, women who have attended programs. We'll try and identify if any one of them would like to join a support group, because there are people who have had PCOS and would like to share their knowledge and like to share their experiences so that others can benefit. And I think that's extremely important for us to do that. And Malika, you want to say something?
No, I had nothing to add. I was talking about the fitness aspect of things, but I'm obviously, as you personally know, I'm very passionate about the women-centric focus and how to bring the digital universe together with brick and mortar, and how we can make people much more aware of their conditions and how to manage their conditions, how to empower them before they see their physician, so that they know what to ask without using Google.
Anyone else would like to add anything? Dr. Chavan? Dr. Vyomi?
So the government also has a e-Sanjeevani portal, that is a teleconsultation. So as you mentioned, public-private partnership and PCOS society could pitch in. I think this is one platform where experts could help
Sure.
rural and other
Sure, we can
patients
do that.
connect.
We can do that, yes. We have, I think, one or two women here or girls here who are wanting to speak a little bit about their PCOS issues. And we have Nandini Chatterjee, who has PCOS and wants to talk a little bit about her experience.
So I think, everyone can hear me? Yeah. I think we've had a lot of very fruitful discussion today about PCOS, awareness, and while those are all valid points, I think I also wanted to actually touch upon obesity and how healthcare professionals actually deal with it as an issue. Because while it's 100% an issue, not to say it's not, but I think there's a certain sensitivity that you have to have when you speak to someone about it. When I was 15, 16, I went to so many doctors, and I remember there was no sensitivity. It was just like, okay, you're overweight, you need to lose weight. There was no, what is the issue, what's going on? There has to be like a systematic approach to it, when you discuss these things with patients who are vulnerable. Just like we discussed, Dr. Bindu, I think, said how there was someone who got bulimia as a result. We don't want people going the other way where, they develop an eating disorder. So there's a sensitivity that I think all healthcare professionals should definitely have when discussing certain issues, especially with weight. So yeah.
One thing that comes up a lot for us is obviously with our fitness centers is how to manage weight, how to lose weight, and everybody's talking about weight. And I think the medical community, obviously sitting in front of us, will vouch for the fact that we're moving away from the classic definition of BMI. We're getting much more into body fat percentage, healthy fat versus unhealthy fat. And so I think it's important when you're talking to a clinician to make sure that that clinician is addressing not just the root of the body composition, but the fact that it is body composition and not just weight. I think that's just an important thing for anybody struggling with this issue to be aware of.
I'll just ask each one of you to just say one statement which will sort of tell me what each one of you is going to do for PCOS. Starting with Dr. Chauhan. You're in trouble today. Have you got a mic? Yes.
Yes.
So as the Deputy Director of Maharashtra State Government, Health Services, is there anything you would like to do after listening to this whole discussion and would like to take it further? I'm not saying you have to, but would like to, because there are limitations to everything one does. But what you think you would like to do?
Basically, madam, right now, being a public health personnel of government, we are facing a lot of problem of skilled manpower. That is main issue for us. So we are searching for partners, development partners, and you are there, and we will together can do some better scheme, which will be helpful for the community. So public health department is actually facing for manpower crisis. Infrastructure we have well developed. It needs little strengthening and skilled manpower and availability of medicine and diagnostic equipments or instruments.
Yes.
That is a requirement.
Yes.
And for that, sometimes there are many things. Being a technical officer, I know I want this, but I don't get that. I get another thing which is not actually useful for me at this time.
Yes.
That is these are some internal issues with us. So we cannot make our decision on our own. Policymakers, we have to suggest them.
Yes.
And one more problem I have faced, when being a government systems officer, I suggest something, it will not taken very seriously. But when someone who is external, like NGO or any other researchers who is doing some research, if that thing, same thing which I was saying on my experience, it will be not listened carefully. But when it comes from outside, it will be definitely taken. So, if I get chance to, I will share with you, and we can put it to the government through your.
Absolutely, absolutely. I think that's something which we will all look forward to. And thank you very much for that.
Thank you, madam.
Thank you so much. Dr. Beena Joshi, you want to say something? I think ICMR does a lot of research, but at the same time, as clinicians, we have a lot of patients, and we are happy to do projects together because we need Indian data. We travel abroad and we talk about, all Western data, and we know Indian ethnicity is different compared to American or European ethnicity. We need our own data. We can't talk about it because we cannot, in private sector, we can't do research because patients pay for every test they do, for everything they do, and it's not fair to them for us to do research on them. So in short, I think we need to encourage public-private partnership in research, and I know everything has its limitations. So what best can ICMR do?
So I think, ma'am, as Dr. Chauhan put it, ICMR now, I think, has a right kitty in terms of the prevalence, the health system's preparedness, the economic aspects, and together, I think it will form a good way to advocate including PCOS in its system. The NCD program, which sir is in charge, is only targeting people above 30 years of age. So can we lower it down and have more screening? And that is one way to pick up PCOS. And a lot of intersectoral linkages. So I think the buzzword today is implementation research as well, because government also is handicapped, and so we need to show way or strengthen by collaboration and showing
Absolutely.
how to do it. The other thing is if there are new drugs or something, but nothing new is so much coming in PCOS field, and so that is something I do not know. But the prevalence study that we undertook, we are planning a long-term cohort follow-up of these patients, because that long-term data is very essential from Indian context. And yes, any ideas are welcome if we can pitch together.
Something, in India we use a lot of inositols. There's no evidence on it.
Yes.
All my American and European friends tell me we are depending on India to do this research because you'll use so much inositol. But we can't get hold of any funding to do that research. So that is something as ICMR can take it up as a project for assessing inositols, because it's something which exists in your body. It's a natural thing which is existing. But in PCOS patients, it's low. So by giving inositol, we may be able to help our patients.
Sure.
What about you?
Yeah.
Pooja?
For
Anything last
PCOS,
you
I
want to
think
add?
my next effort, mine and my team, will definitely be to partner with physicians, inform them. Today we are the only fitness method in India that is designed by women for women. And I think it's incredibly important for medical professionals and the medical community to understand what that means, because at the end of the day, all of these educators I spoke about, the patients, all of them will come to you for support, and they will want to know, okay, you're telling me to exercise, what do I do? And so my next effort in this and to support PCOS will be to partner with physicians and inform them of exactly what this fitness method is and why it's so important for women to partake.
Perfect, absolutely. Anyone else? You want to add something, Pooja?
That you have a bias for action. She's really putting a gun to our heads to say, what are you going to do next? I like that a lot. I think I am personally like that as well. But I can tell you, all of us in some shape and form are influencers as we are sitting here, whether it is about policy advocacy or innovation, like you said. I think I'll continue to do that. Be the spokesperson, be the influencer, channel Philips' innovation efforts towards this move, if I can, to whatever extent I can, and also make sure that we participate in initiatives which require a public-private partnership as well.
Thank you so much. Anyone else wants to add anything?
I
Yes.
can just say that I can advocate it in the preconception program.
Yes.
Which sooner or later government of Maharashtra or India is going to be releasing. And secondly, the way you rightly said that in school programming, when we are doing our sessions on nutrition and health, PCOS will surely be mentioned in those programs.
Thank you. Thank you so much. You want to add anything?
Yeah,
Purnima?
just actually quite in a similar way. I have a 13-year-old now, and I'm comfortable talking about what I faced in my PCO journey. I think it's easier now when you've had a child. I think what we need to do is kind of break that stigma. Because I was not even happy to talk about my own thing when I'm, somebody who's educated, aware. I know I need to stand up for this. I think just encouraging people in your own small circle, making sure that if you have someone who, might actually be facing this similar challenge, facing a difficulty getting pregnant, just maybe just nudging them to that. You hear somebody with a teenager who's actually got painful periods, not to make that seem like it's the end of the world.
Yeah.
So I think we all
Thank
can
you
do
so
that.
much.
Yeah.
Thank you. Nandini, you want to say anything? I think I must compliment both these young ladies who have taken up the step to come and talk to all of us about what they are going through and what needs to be done. Tell us one thing you want us to do for you.
For me, I think we can just create more awareness, and I think I second her where it starts small. Like today, I'm explaining to my friend, "Oh, what is PCOS? What does it mean? Is it a common thing?" Like people think it's not a common thing, and I'm like, 1 in 5 women in India has it. That's not okay. Some people may have it. Plus, a lot of the stigma, like we have that everybody who has PCOS is overweight, or that it's actually a cause of PCOS. While it is a important factor that needs to be monitored, it's not the cause. So a lot of these misconceptions, you start small, just at a smaller level, and definitely on a bigger level, all of you are growing, learning, and yeah.
So thank you very much, panelists. I think you all have done a great job, and thank you for being with us. And I think we'll end this session, and I'll request Dr. Sangeeta to come in and make the next announcement, please.
Thank you, madam. That was a very power-packed discussion, and the take-home message is quite clear. We need to educate our health workers right up to the PHC. We need to empower our women, our young girls, so that they can ask for more. There is scope for innovation. Research is very important, and we need to have a PCOS support group. Friends, we will have the next session, which is the most interesting part, an open one-to-one session, which all of you can have with all the specialists. But before we do that session, I have a very pleasant task to do. This program was made possible by Philips India Limited, and I take liberty to call them the patriarch of the program. It is the CSR funds that have made this program possible, and we truly appreciate the time and effort of Ms. Pooja Bedi and Mrs. Monica Bahal, who did not leave a single stone unturned to ensure the success of this program. We thank all our specialists who have given their invaluable time on a Saturday afternoon for the panels and one-to-one discussion. I will be failing in my duty if I do not specifically mention following of the few people. Deputy Director of Health Services, Dr. Duryodhan Chavan, Dr. Vyoma Dalal from UNICEF, Dr. Beena Joshi from ICMR, Mrs. Malika Parekh and Mrs. Purnima Thakur, Mrs. Aditi Kapoor from Blue Sea. We express our heartfelt gratitude for your time and contribution in furthering the agenda of the PCOS Society and for bringing PCOS center stage. We express our gratitude to the tireless efforts of Blue Sea staff, especially Mayuri, the FTC team, web stream team, and the staff of PCOS Society. Guys, all of PCOS Society rocks because you are rocking. And last not the least, I would like to thank all of you for being here today because you are the center point of PCOS Society and us. Now, before we move on to the open forum is designed so that you can have a planned session so that you feel free to ask all your questions. about PCOS, acne, hair growth, simple things like how much to exercise, what exercise to do, should I be running on the treadmill or not, should I do yoga or Pilates, should I do intermittent fasting or the keto diet, should I have cold press oil or the normal processed oil, should I have rice bran oil or should I have olive oil, and so forth. We have all the best experts here in the industry today, and we invite you to interact with them on a one-to-one basis. We will have the placards in this room to display the specialists, so you can walk up to them, feel free to ask whatever questions you want, and you are welcome also. Do the discussion now, or you can go outside. We have some word search puzzles which are going to trickle your brain to ask more questions to our experts. So enjoy doing those puzzles with us outside. And after that, forget PCOS, because then you can enjoy the mouth-watering spread we have. We don't have shing chana, as Madam said. All the nutritionists are going to be disappointed, but we have food which is food for the soul, satiety for hunger. So enjoy that spread, and I hope you will have a great evening. So I hope to see you interacting with our specialists. Enjoy the search puzzle, word search puzzle, and enjoy the spread. Thank you so much. Slipped on something. We have a lot of specialists available here. Let me introduce them. There is Dr. Riddhi, some gynecologists. Dr. Riddhi Desai, may I request you, all the gynecologists? Yeah, okay. Dr. Riddhi Desai, please come up on stage. As I call out your name, please come up so the audience can see you and then they can interact with you. She's a gynecologist and endoscopic surgeon, a member of the Youth Brigade of PCOS Society, extremely talented and has won many awards on medical platform. Dr. Vishesha, she's a gynecologist and a fertility consultant at the Gynac World. Dr. Nagdipti Naik, she's a gynecologist and fertility consultant with the Indira IVF Center and a member of the Youth Brigade of PCOS Society. Dr. Pia, yeah, she's a very senior endocrinologist attached to Bombay Hospital and Breach Candy Hospital, founder member of the PCOS Society and a diplomate of the American Board. Dr. Jugal Gada, are you here? Dr. Jugal Gada is again a senior endocrinologist attached to Bhatia, Breach Candy, Saifi and Kambala Hill Hospital and an associate professor with Nair Hospital. Dr. Bindu Salekar, our expert dermatologist. Dr. Devita Buraria. Dr. Devita, are you here? Yes, hi. She's a senior dermatologist. She's a director of the Fab Derma Clinic and is attached to Bethany Hospital in Thana. She's also a trainer for cosmetic dermatology workshop for doctors across India and Nepal. Dr. Sapna, she's the head of Empower. Dr. Sapna here. She's the head of Empower and a psychiatrist trained not only in India but also UK. She has evidence-based holistic approach to help patients facing mental disorders and works not only with the patient but also with the family. Dr. Gauri, Dr. Gauri Jariwala is a master in the musculoskeletal therapy. She was attached to Bhatia and Saifi Hospital, but now she's a partner at the Physio Rhythm Clinic at Opera House, and she provides services along with a team of 30 other physiotherapists. Dr. Ankita is a cardiopulmonary rehab specialist and works with patients with lifestyle disorders and helps them to improve their quality of life. She is not only a founder member of the Society of Cardiopulmonary Rehab, but also India representative to the International Council. Mrs. Neeti Desai she's a consultant nutritionist in South Mumbai, attached to Kambala Hill Hospital, and was the official nutritionist for Femina Miss India in 2008. Miss Nemisha Khatau, she is also a nutritionist from UK, and her areas of expertise is nutrition in PCOS, diabetes, and pregnancy. Mrs. Shilpa Amin is a certified nutritionist from the US. She has achieved Precision Nutrition Level 1 certification and established Balance and Beyond, which is a Mumbai-based clinic specialized in clinical nutrition. I do hope all of you will take the advantage of interacting with them on a one-to-one basis and ask questions that haunt you, but you are not always accessible to a specialist to ask them. Don't forget that do the word search puzzle outside and enjoy the mouth-watering spread. Thank you. So we have all the counters in the front where you will be able to meet all the doctors.